Katherine Heisel, and my presentation is on aesthetics with veneers. First, let's take a look at what a veneer is. A veneer is one of the most revolutionary techniques that dental professionals have created in the last 25 years. This technique is that porcelain is able to bond onto composite, which would be able to bond onto the surface of a tooth. The thing with veneers is they're not only appealing to you, but it helps you have self-confidence, it helps with your relationship with others, and it can also help you have success in your career, which is crazy to think that your teeth have that much effect on you. But in the viewpoint of a dental professional, they need to be knowledgeable on the background of the clinical as well as laboratory aspects of veneers, and they also need to be knowledgeable about the scientific background of the whole procedure. The criteria for a porcelain veneer must be carefully known about because once a porcelain veneer is placed, you can't take it off the tooth. Now let's look at the history and background. There's an increase in porcelain veneers in the dental society because it's such a conservative restoration process for unaesthetic anterior teeth. This technique was first introduced by Dr. Charles Pincus in 1940. His developments were in composite resin technology as well as acid etching. Composite resins, however, were known for thermal dimension change, poor wear resistance, as well as staining, and their life expectancy was about 4 years. When the discovery of anterior veneers came along, their life expectancy was much longer. In fact, when I was in the 8th grade, I got my braces off, and my dad, he's a dentist, he wanted to build up my teeth to make my smile look bigger and beautiful. And so he used composite resin and built up my 4 front teeth. I'm 22 years old now, and this tooth is actually darker than my other 3 teeth because the composite resin has stained. If I would have used veneers back then I probably wouldn't have this problem. Now we'll look at case selection. To ensure that you have long-term success for your veneers, you're going to want to choose the correct candidate. Dental professionals will look for people who have high standards for oral health as well as their hygiene, and they'll also want to look for people who have good tooth surface. There are 5 main reasons for placing veneers. These are 1, masking of discoloration resulting from trauma, 2, correction of unaesthetic surface defects, 3, endodontic treatment, 4, reparations of structural deficiencies, and 5, tetracycline stains. Now we'll look at the contradictions. There can be decreased success when porcelain veneers are placed on teeth with these defects. 1, existing large restoration or root canal treated tooth with less structure of the tooth. 2, inadequate tooth enamel as well as tooth structure such as dentinogenesis imperfecta, and that's pictured here. As you can see, the tooth surface is so tiny. Even if veneers were placed on it, they would be so tiny. 3, a patient that has an oral habit causing excessive stress on the restoration as well as excessive interdental spacing. Now we'll look at the shade selection process. This is another parameter for long-term success. To choose the shade of the porcelain, you must be able to match your patient's teeth with your color shade guide as seen here. There are some tips for shade selection. 1, the dental professional should match shades in early hours of the appointment. This will allow your dentist to not have color fatigue. 2, clean the patient's teeth and make sure there's no debris or stain on the teeth. Debris can be anything from food to pepper, anything that obstructs the view of the tooth. 3, avoid shade selection against a bright colored background. So if your patient has a bright colored shirt on, you're going to want to drape a neutral colored blanket over your patient so it doesn't obstruct your view. And also if your patient is wearing lipstick or lip gloss, you will ask them to remove it. 4, have the mouth of the patient at eye level of the dentist, so you'll be wanting to look straight on so you get a perfect shade. 5, use the patient's canine as your tooth reference. 6, the shade comparison should be performed at 5-second intervals. Again, this is just for eye fatigue and color fatigue. 7, grind the neck of the shade tab off. So these shade tabs are actually silver, but in most cases, they're more of a tooth colored, and so you're going to want to grind that off. And 8, if the dental professional is having any confusion between 2 colors, you will always go with the color that has a lower chroma and a higher value. Before the beginning of preparations and after the establishment of the desired shade, you're going to want to do the pre-existing restoration as well as defects should be corrected and the anomalies should be contoured. So now we'll look at tooth preparation. There are many reports about low success rates due to the fact that teeth were not prepared correctly. The preparation is needed for space, it needs to have a definite finish line, it needs a rough surface for better retention, and it needs to get a fluoride-rich layer. Now we'll look at the clinical steps. There are 3 sequences of tooth preparation: 1 labial surface reduction, 2 proximal reduction, and 3 incisal reduction. First, we'll look at labial surface reduction. This is careful depth control, which is necessary for this step. By using a 3-tiered depth cutting diamond, you will make 3 horizontal surface depth cuts prepared. This is shown in the picture here. You must carefully use the depth cut as a guide. There are several more success rates seen when the supragingival line is used, mainly because 1, moisture control is better, 2, the increase of the area of enamel, 3, accessibility is great, 4, the visual confirmation is excellent, and 5, maintenance of hygiene is better. Now we'll look at proximal reduction. This preparation will extend lingually only if the peg incisor or diastema has to be restored. The contact area should be preserved as much possible due to the fact that 1, it will simplify the try-in, 2, it will be extremely difficult to reproduce, 3, it will save clinical time, 4, the bonding will be easy, and 5, it will provide better access. Now we'll look at incisal reduction. There really is no consensus if incisal edges of the patient's teeth should be included in the procedure for the preparation of veneers. But some dental professionals do think that it is necessary in all cases to be able to enhance the mechanical resistance of the veneer. But some dentists believe that you incorporate the incisal edge only when dictated by aesthetic or occlusal requirements. Now we'll look at the gingival displacement and impression technique. This is usually needed for people with maxillary teeth or dark teeth. Apical infiltration over the teeth with local anesthetic solution is advised, but you must be very careful when using it. When impression is being made, there should be a single cord which goes among the gum line and it will stay there, and it's pictured here. There's rarely any bleeding as most patients will have healthy gums. For the impression technique, any recognizable elastomeric impression material is viable to use for the impression of the teeth. Now we'll look at provisional restoration. There is seldom any patients that will experience any sensitivity when preparing the teeth for a veneer. So many people do not want to get veneers because they're like, oh, the dentist is going to hurt me. Oh, it's going to hurt my teeth. It's going to look terrible. But most people don't even have a problem with the way it looks before you get your veneers on. And even if you have a problem with the way it looks, your dentist can make a temporary cover that can go over your teeth. We'll look at the laboratory procedure now. There are 4 groups of ceramics that are used for veneers today. 1 is feldspathic porcelain, which is pictured. It's very thin. It's almost see-through. 2, heat pressed porcelain. 3, cast or pressed porcelain. 4, CAD-CAM. Porcelain that is made of baked feldspathic porcelain will allow for the minimal veneer thickness to be 0.3 millimeters thick, which is good because that's very, very small. And this will allow the amount of substance that needs to be removed in the preparation to be very, very minimal. Now we'll look at the try-in. The dentist should always inspect the veneer for any cracks or imperfections before putting it upon the patient. If there's anything, they need to redo the whole process. The dentist will also moisten the teeth and internal surface and place your veneer on there for a pre-look. They'll see how it fits, see how it looks without putting any cement on it. Now we'll look at the ponding procedure. There are 3 different ways to attach the porcelain laminate to the structure of the tooth. 1 is micromechanical attachment, acid etching. 2 is combining attachments, and 3 is chemical attachments, which is cement. There have been reports that the clinical longevity of ceramic veneers is most related to marginal adaptations. This is such an important step. It's the final step, and you need to make sure that it is perfect. And after that, you're all done. Now the patient, all he will need to do, or she, will need to get a professional cleaning 3 to 4 times a year. But when you get your professional cleaning, make sure to tell your hygienist that you have veneers on, or she could use something such as ultrasonic scaling or air abrasion, and that can hurt your veneer. Failures. The survival probability of porcelain veneers is estimated to be 94.4% at 5 years, 93.5% at 10 years, and 82.93% at 20 years, which is such good odds. There are failures, however, when the finish line crossed an existing filling, when There are failures found when there's a ceramic fracture, and there's failures found when people with parafunctional habit and discoloration at the margins in smokers. Finally, the success depends mainly on the method of fabrication, that's your dentist. Success depends on the reliance of case selection, also on your dentist, but success will mainly depend on you as the patient. You're the one who have the veneers. You need to take care of them once you get them placed on you. The porcelain veneer is very aesthetic as well as conservative treatment option for several different indications. If you have any problems with your teeth, if you hate how your smile looks, if you just want to make them look bigger, more beautiful, veneers are such a good option for that. It's such a conservative restoration, and I think everyone can get it and they will love it.